On behalf of the Augusta Library, thank you for joining us for today's virtual workshop, Let's Talk About Pain Medicine, presented by Shannon Mason Young and Cassie McLean of Wisconsin Literacy Incorporated and sponsored by Security Health Plan. If you have any questions during the program, you may type them in the YouTube chat window or contact the library. I will pass the questions along to Shannon and Cassie. After the program, you may pick up a free workbook, handouts, and a drug deactivation kit. Thank you for joining us for today's a drug deactivation disposal system pouch at the Augusta Memorial Public Library while supplies last. For more information about this and other library programs, please visit us at www.augustalibrary.org. Thank you. Okay.
Thank you, Stacy. Good afternoon, everyone. My name is Shannon. And
are we good to go, Stacy?
I think so. Okay, so good afternoon, everyone. My name is Shannon, and Cassie and I will be your presenters today. Our program today is called Let's Talk About Pain Medicines. And I'm going to share my screen here and pull up our PowerPoint. Okay, so our program today is called Let's Talk About Pain Medicines, which was developed by Wisconsin Health Literacy, a statewide organization that puts on programs like this to help people stay healthy. We worked with doctors and pharmacists to put together today's program about safe opioid use. We will talk about several things, including the differences between opioids and non-opioid pain medicine, how to safely store your medicines so others can't get them, and how to get rid of your unused medicine. And again, we would like to thank Security Health Plan for supporting this project. And just a quick overview again, Wisconsin Health Literacy. We are a division of Wisconsin Literacy that has over 70 members statewide, and we put on community projects like this one today. And we also have a health literacy summit that is hosted every other year, with this April 2022 being our next summit. If you'd like more information on Wisconsin Health Literacy, our website is right here, wisconsinhealthliteracy.org. Take a visit. We have a lot of great resources on our website to share. So let's get started. We are going to talk about the differences between prescription opioids and other pain medicines. So what do you think of when you hear the word opioid? Some people think of opioids as only an illegal or street drug, such as heroin. And heroin is an opioid, but the opioids we are talking about today are prescription pain medicines, and they can be just as addictive as heroin. So it is important to take them exactly how your doctor or pharmacist told you to. So what are prescription opioids? These work in the brain to block pain signals. You need a prescription to buy them. They can make you feel really good, but you can also get addicted to them. This means you may feel a very strong need to take them or to take more medicine to get that high or good feeling. So what are some examples of opioid? We're going to talk about some examples of opioid medications. So hydrocodone. Hydrocodone is also known, you may know it as other brand names, Vicodin, Loratab, or Lorcet. Oxycodone, other names may be Oxycontin, Percodan, Percocet. Morphine, brand names, you may Avenza, Cadian, MS Contin. Then codeine is another opioid, fentanyl, tramadol, and again, these have brand names Ultram and methadone. So these are all opioids. But there are some pain medicines you can buy without a prescription, and they work in the part of your body where you feel the pain and not in the brain. You can't get addicted to most of them. Here are some examples. We have acetaminophen. Again, you may know this is Tylenol, the brand name. Ibuprofen, brand name would be Advil or Motrin. Naproxen would be Aleve as an example. And there are some there's some pain medicines you can buy without a prescription, and they work, sorry, I just double up my slide. There are some pain medicines you can buy without a prescription. They work in the part of your body where you feel the pain and not in the brain. And I just went through that. I apologize. I doubled up on my slides. Okay. And then there are other non-opioid medicines you can get with and without a prescription. And you would want to talk to your doctor to see if one of those medicines are right for you. And now I'm going to pass along the presentation to Cassie.
Sure. Thanks, Shannon. So now we're just going to take a look at some of the different ways that you can take opioid pain medicine and learn a little bit about the history of opioids. So first of all, they can be taken as a pill. And what are some other names for pill? Sometimes you'll see them listed as capsules, caplets, tablets, gel caps. Those are all just different terms for pill. They can also be taken as a liquid. If you use a liquid medication, you should always measure the medicine using a syringe or a small cup or other measuring device that you can get from the pharmacy. Don't use a teaspoon from your drawer because that may not be the right measurement, and that can be very dangerous. Also, sometimes you need to shake a liquid medicine before using it. And this helps to make sure you get the right amount of medicine. But only shake it if the label or the doctor or pharmacist tells you to. Because if you're not supposed to shake it, it might get foamy and then it's hard to measure. So always ask your pharmacist if you aren't sure how much medicine to take. They can also be taken as a patch. So a patch has medicine on it, and it sticks onto your skin so that the medicine goes through your skin into the bloodstream. You should put the patch on skin without any hair, and because the patch will not stick to your skin right, and you won't get all the medicine you're supposed to if it's on a spot that's kind of hairy. You should never cut a patch into pieces unless your pharmacist says it's okay to do so. The medicine dosage on a patch isn't spread out evenly. So sometimes if you cut it, you can get way too much medicine if you use just a piece of the patch, or you might not get any medicine. So it's not you don't want to be cutting up a patch. Be sure to remove your old patch before you put on a new patch. And make sure you get rid of the patch when you're done using it, so you don't have to worry about children or animals getting into it. Fold the patch in half so it's very hard for a child to pull it apart and stick on themselves. If they do that, they can get very sick or die if they swallow or put an opioid patch on themselves. And we're going to talk a little bit later about ways to get rid of your medicines when you're done with them. But if you have questions, always ask your doctor or pharmacist. So to help us understand the different types of opioids and ways to take them, it's also important to understand a little bit about the history of opioids. So years ago, people didn't know that opioids were so addictive. Many people had opioids prescribed to them to treat their pain. Because so many people had opioid medicines, It was easy for someone to try opioids that belonged to friends or family. Many people, both old and young, became addicted to opioids. And some people overdosed on opioids and died. When people become addicted to opioids, they sometimes couldn't find or afford more opioids. This led them to start using heroin to satisfy their cravings. Heroin is dangerous and addictive, and it's usually injected into the blood. And it's very easy to overdose and die from heroin. You may also have heard about the drug fentanyl in the news. Fentanyl is an opioid medication that comes in a patch that you put on your skin. The patch is safe to use when it's used the right way. It does not come in a pill form because it is so strong. Drug dealers are now selling heroin that has fentanyl in it. Because fentanyl is so strong, it's even easier to overdose and die from it when it's injected into the blood. Opioid medicine can be very dangerous if it's not taken correctly. People who misuse these medicines can become very sick and even die. In 2016 in Wisconsin, more people died from opioid overdoses than in car crashes. And more people overdose from prescription opioid medicine every year than from heroin and cocaine combined. Today, over 130 people die every day in America from opioid overdose. It is a crisis. So we now know that opioids are very addictive and dangerous. Doctors are now very careful about giving opioids to people, but there are still good reasons to use opioids. Sometimes the best choice for pain is to take an opioid, and that's okay. It's very important, though, that you take it in the right way, and it's important to take it in the way your doctor or your pharmacist tells you to. So, for example, if your doctor prescribes you opioid medicine after hip surgery, use it for your hip surgery pain and as the label and the instructions read. Be sure to follow any warning labels that come with your opioid medicine. These may be on the label or a sticker on the bottle, or they might be found in extra information, such as a printout that is given to you with the medicine. Always be sure you understand these warning labels and follow them. They help the medicine work best and keep you safe. Did you know that taking too much opioid medicine can make it hard for you to think fast while you're driving a car or using machinery? It can also slow your breathing so much that you fall asleep. And if it slows it enough, you can even die. So it's so important that you read, understand, and follow any warning labels or special instructions. Remember, ask your pharmacist if you have questions about these. They can help. So Shannon, I'm going to go back to you for you to talk about the next section.
Thanks, Cassie. So we're going to take a look at tolerance, dependence, and addiction. So if you take opioids long enough, two things will happen. You will develop a tolerance for them. This means that the same dose no longer works as well to relieve the pain. You may be able to get a stronger dose. Talk to your doctor about this. You will develop dependence. This means that if you suddenly stop taking your medicine, you could have withdrawal symptoms such as nausea, vomiting, diarrhea, and severe stomach pains. You may have to decrease the amount of medicine you are taking slowly to stop without having withdrawal symptoms, and your doctor can help you do this. You could also be at risk for addiction. This means that you may feel like you need more medicine to get the same high. This is a harmful use of opioids. If you are having any of these feelings, it is very important for you to talk to your doctor so that they can help you. Opioid addiction is a very serious, it's very, very serious, and it can ruin your life or kill you. So it is important to know how much opioid pain medicine to take and when to take it. So I'm just going to make this a little bit bigger on our screen because we're going to focus on this information right here. So sometimes it's hard to understand this from looking at the label, but these are both very important to know. So let's take a look at this pill bottle right here that you see. Let me get my little pointer here. So we're going to take a look at this on the pill bottle where it says, take 1 or 2 tablets as needed for pain every 4 to 6 hours. So let's talk about what's important with those directions. You should never take more medicine than your doctor prescribed. If your pain is not adequately controlled, you need to call your doctor's office. Knowing that it may not be possible to make all the pain go away, but if it is really bad, you should call your doctor. And this prescription says that you should just take 1 or 2 tablets as needed for pain every 4 to 6 hours. So what does as needed mean? We're going to practice a couple examples from this label here. So let's say if your pain is better, then just take 1 tablet instead of 2. If your pain is better, wait longer to take the next dose or stop taking it. Or if you wait until your pain is very bad before taking the next dose of medicine, then it will take more medicine to get your pain under control. So if that is true, then take your medicine closer to every 4 hours. But remember, if you feel that you don't need to take more medicine before the 4 hours is up, it is time to call your doctor. Okay, so then we're going to get this back to here. Now we're going to take a step back and we're going to look and review an example of an opioid prescription label. Let's see. Okay. So there are different parts of a prescription label that we need to understand so that we can take our opioid medication safely. Now, as you can see from this label, there are many things written on a prescription label that are important to understand. Labels from different pharmacies may look very different, but all labels should have these parts. So let's look at the patient name. So your name will be on your prescription medicines. Most pharmacies will also print your address on the label. You should not give your medicine to anyone else. And you also should not take any medicine prescribed to someone else. It is illegal, but even more importantly, this can be very dangerous. Also, you're going to see the name of your medication, the name and the strength of the drug. So when we look at this prescription label here, what we see is the opioid prescription is hydrocodone and acetaminophen. The strength is 5 and 325 milligrams, and they're in a tablet. The 5 is the strength of the hydrocodone, and the 325 is the strength of the acetaminophen. The brand name or the generic name may be on the label, and sometimes pharmacies will print both of them on there. The next very important thing are the instructions. So the instructions tell us how we are to take the medicines. So here is similar to the example we used just before. Take 1 or 2 tablets by mouth every 4 to 6 hours as needed for pain. And again, we had those examples like that we just talked about. If your pain is better, then just take 1 tablet instead of 2. Or if your pain is better, wait longer to take the next dose or stop taking it. So it's very important to understand your directions. The quantity. This is the number of pills, tablets, or cablets that are in the bottle on the day the medicine bottle was filled. It is important with opioid medications and medicines to keep track of the number of pills you have left in the bottle. That will help you know if anyone else has been taking them. So in this example, the prescription, the medication was for 40 pills, 40 tablets. So if your medicine is a liquid, it may be measured in milliliters. So you may see MLS there in abbreviation. So here, just going up again, we could see that these are tablets. Here it may say liquid or however the medication is filled. The other thing we're going to find on our label is the name of the pharmacy. So it shows who filled the prescription. The pharmacy phone number will also be on the label, and this is going to be the number for you to call when you have questions about your medicine or need to refill your prescription. And we are going to talk about refills in just a second in further detail. The doctor's name is also going to be on the label. And notice that the doctor's phone number is not on the label. Usually it's not on the label. What you'll see is the pharmacy phone number. We're also going to see when the prescription date was filled. It will, on this example, we have May 19th, 2019. So this is the date that the pharmacy got the medicine ready for you. Some pharmacies will put the medicine back on the shelf if you don't pick it up within a few days. And the number of refills you're going to find, in this case, this prescription has no refills. If you see that there is a refill listed here, it will mean that you can get more medicine from the pharmacy without going back to the doctor. And you will get the same number of pills for each refill. You cannot get refills with most opioid medicines. If you feel you need more, you need to call your doctor's office. And then we're going to go up here to this item here, which is your prescription number. So each one of your medicines will have its own prescription number. And this is the number that the pharmacist uses to refill your prescription. When you call the pharmacy to refill your prescription over the phone, they will ask you to read this number. And at some pharmacies, you will hear a recording asking you to enter the prescription number on the phone's buttons. And if they do that, you just type in all of the numbers, even those after the dash. On some labels, you are going to see a code, and this is going to be, this code can be scanned by the pharmacy to refill your prescription. And the last thing we're going to look at is the use before date. And some labels might call it the expiration date instead. Sometimes there is not an expiration date on your medicine bottle. But if there is, don't take your opioid medicine after this date. It may cause you harm if you do, or the medicine may not work as well. So this is a lot of information to think about. Labels from different pharmacies might look different, but all of them are going to have this basic information. The important thing is to make sure it all makes sense to you. Always double check that your name is right. Be sure that the medicine the strength of the drug, and the directions, all the directions make sense to you. It is important to know these main parts of the label so you can take your opioid medicine carefully and safely. And if you have any questions, ask the pharmacist when you're picking up your medicine. Another thing, you can also ask the pharmacist to see if a prescription label can be printed in other languages. Some may be able to do so. So I am going to hand it over to Cassie now.
Great, thanks, Shannon. And we're going to shift gears a little bit now. What we're going to do now is talk about something you might have heard on the news a little bit more. We're hearing more about this now. There is a drug available that can help stop an overdose and save a life. It's called Naloxone. Now, other names for it, and the one that I hear most frequently when it's being talked about are Narcan, Evzio, or Narcan nasal spray. So there are three major types of naloxone. You can get it as a nasal spray that's ready to use. You can get it as a nasal spray that you need to put together before using. Or you can get it in an injectable form. So you can get it as a shot. You're most likely to get a nasal spray version. So if someone has overdosed, which means they have taken too much of their opioid medicine, naloxone can help stop the overdose. This is a life-saving medicine. If you're taking an opioid medicine, be sure your family or caregiver knows how to give you this medicine. An overdose kills people when they become unconscious and stop breathing. So someone else usually has to give the person the naloxone. Sometimes you need a prescription for this medicine, but some pharmacies will let you get this medicine without a prescription from a doctor. This means family members or friends of somebody who may be at risk for overdosing can get this medicine. Naloxone is not for everyone. It's just for people who are abusing opioid medicines or are addicted to opioids. There is a website you can go to find a pharmacy that can give you naloxone without a prescription. Shannon, can you make that just a little bit bigger so we can see the name of that pharmacy there, or the website? It's dhs.wisconsin.gov. There we go. /opioids /standing-order.hj. You know how websites are. But this information is available on the information that you can pick up in the library. So if you would like more information about this, you can certainly check there. Keep in mind that this might not be covered by your insurance if you don't have a prescription for it, but you can get the naloxone shot at some pharmacies for as low as $21 with a coupon from GoodRx. So how does naloxone work? It starts working in about 3 to 5 minutes from the time that it enters your body. It lasts in the body for about 30 to 90 minutes. Opioids are going to last longer in your body than naloxone does. So it is very important to call 911 after naloxone is given to someone. Why? Because they may require more doses of the naloxone, or they might need other medical help. After someone is given naloxone, they will likely be in a lot of pain. They experience fast and severe withdrawal symptoms. Most likely, these will include nausea, vomiting, diarrhea, fever, sweating, body aches. They are going to be in a lot of pain. If someone has had too many opioids, They may be sleepy, but able to respond to someone's voice. They might have slurred speech, small pupils, or some itchy skin. Those can be warning signs that opioid overdose is coming. Signs that someone has already overdosed are sleepiness that doesn't respond to someone's voice, slow breathing, slow or no pulse, choking or vomiting. At the most extreme, these things can lead to being unable to breathe and then death. And I think, Shannon, we're on the next page.
Yes.
All right.
So it can be dangerous to take your opioid pain medicines with other types of medicines, or they must be taken at certain times of the day. So taking other drugs that make you sleepy makes it easier to overdose and die because you stop breathing. Or the opioid pain medicine may not work as well if you take other medicines at the same time. So other medicines include prescription medicines. Those are the medicines that you need a doctor's note or prescription to get the medicines. Over-the-counter medicines, those are medicines that can be bought without a prescription. Example we like to throw in here would be vitamins are also something you want to keep in mind. They are considered medicines. Herbals, plants, homeopathic treatments, or other cures. These are also considered medicines and may not be able to be taken at the same time as opioid pain medicine. So to give you some examples, that are other medicines would be, if we're looking at over the counter, we have acetaminophen would be one of those that we talked about earlier. Many opioid pills have acetaminophen in them, but you may not know that from the label. So if you want to take another acetaminophen pain reliever, such as Tylenol, you have to ask your doctor or pharmacist first. Otherwise, you could overdose on acetaminophen, and this is very dangerous, and it could cause liver failure. Alcohol, it can be very dangerous to take an opioid medicine with alcoholic beverages such as beer or wine or liquor. It can also include cough medicines that have alcohol in them. So never drink any alcohol the same day as you take opioid medicine. Another example would be benzodiazepines, also known as benzos. This medicine is used to treat anxiety, and when taken with an opioid, benzos can increase the risk of overdose and death. If you take a benzo with an opioid, it is a good idea to talk to your doctor to see if there are safer options for you. If you continue to use both, it would be good to use the lowest dose possible that works for you. So some examples of benzos are alprazolam, brand name would be Xanax, lorazepam, brand name would be Ativan, diazepam, Valium would be a brand name for that. So those are other examples to make sure that when you're taking them, just to be able to talk to your doctor and make sure these, everybody's on board with all the medicines that you're taking. Okay, so if you're taking an opioid, if you have a need to take other medicines, it's important to keep your opioid medicine. Oops, sorry, my slide is advanced. Okay, if you are taking an opioid medicine and need to take other medicines, you should make a list of all your medicines that you are taking and show it to your doctor or pharmacist, and they can tell you if it is safe to take the medicines and herbals while also taking an opioid pain medicine. You can also bring all of your medicine bottles to your doctor's visit. You're always going to want to talk to your doctor or pharmacist to make sure it is safe to take new medicines while you are using an opioid. All right. Now we're going to hand it over to Kathy.
Okay, thanks, Shannon. So now we're going to talk about the importance of keeping opioid medicines in a safe location. So it's important to keep your opioid medicine so that kids and others can't get them and use them. Most people who use the street drug heroin started out using an opioid medicine that they found at home. So you should do the following to keep your family and the community safe. Number one, use a lockbox or a locked drawer and hide the key. Don't keep opioid medicines on your countertops, on your table or nightstand, out in the open where other people can see them and take them. This will prevent them from stealing them and abusing them. It will also prevent young children from accidentally finding them and swallowing them. Keep medicine in the original bottle or container. That way you don't get your opioid medicine mixed up with other medicines. Also, don't dump your new bottle into the old bottle after you get a refill. You want to always know how many pills you have in your pill bottle. This will help you to know if any of them go missing. Make sure that the lid is closed tightly. This will prevent young children and pets from getting the opioid medicine and accidentally swallowing it. It also prevents water from getting into the bottle. Keep your pain medicines in cool, dry places away from light. Heat, steam, water, and light might make a medicine not work as well. And it's important to keep medicine out of the bathroom where you have steam and water, and certainly don't put them over the stove where you have, where heat can be an issue. So those are just a few tips on keeping your medications in safe locations. What we want to talk about now is what you do to get rid of your unused opioid medicines. It's always important to get rid of them as soon as you are no longer using them. As we said earlier, most people who began using heroin first started misusing prescription opioids that they found at home. And this includes kids and older adults. So leaving unused opioids in the home can increase the chance that younger children or grandchildren may find them and accidentally swallow them. It's very dangerous and can kill them. So you have to get rid of your unused medicines. One place you can check, most police stations will take back your unused opioid medicines. I know that where I live, I can take any medication, opioid or other, to the police station. They have a secure area. I put them in a Ziploc bag and I drop them into this secure area, never to be seen again. And you can also ask your pharmacist. They can tell you how to get rid of your unused medicines. You can also make sure you're following the instructions that come with the medicine. They will usually have information about what you should do when you are no longer needing that medication. And then there's something that we mentioned a little earlier. We talked about a drug deactivation kit. And Stacy at the library does have some of these deactivation kits that can be picked up. And we have a short video we're going to show now about how these drug deactivation kits work. So Shannon, you want to go ahead and we'll start that video. And just hang with us a moment here as we pull that up. Oop, do you have your sound? Did you do the sound? We're going to try that one more time, and we'll make sure we have the sound with it now. Okay. There we go.
The Deterra drug deactivation system is an independently tested, safe, and environmentally sound solution to permanently deactivating, destroying, and disposing of unneeded pills, patches, liquids, creams, and films right at home. To begin, tear open the pouch. Do not remove inner pod. Next, place unused medications inside. Once the drugs are in the pouch, fill halfway with warm tap water and wait 30 seconds. The water-soluble pod will dissolve, releasing the carbon and starting the deactivation process. Some foaming may occur during this time, and it's important to leave the pouch open, so air may be released before sealing. After 30 seconds, seal pouch tightly, gently shake, and dispose in normal trash. The empty pill bottles may now be recycled. For more information, visit deterrasystem.com.
You ever wondered?
On to the next one. So the drug deactivation kits, as you saw, are very simple to use. So just to review, and Shannon will pull this back up again. There are just a few simple steps with it, and it's so nice that you can just do this and dispose of it in your trash. So the first step is you tear it open, you place your unused medications in the pouch, fill it about halfway with warm water, seal the pouch, give it a shake, and you dispose of it in your normal trash. So if you don't have the ability to take them to the police station or any of the other things that we talked about, this is just a great way to be able to dispose of those no longer needed medications. So if you're wondering how much you can put in one of these, the drug deactivation kits do come in different sizes, but you can basically put 45 pills or 6 ounces of liquid or 6 patches in one of these drug deactivation kits. If you have a combination of these different types, you can put in up to 15 pills and up to 2 ounces of liquid and 2 patches. And that's enough that can go in and will take care of them being deactivated. The other thing I wanted to mention is that most of our communities do participate in the National Prescription Drug Take Back Day, and we did just recently have one of those. And Shannon and I looked to see when the next one will be. They're generally held twice a year, and the next one will be in April. But I would encourage you, if you have pills that you are not using right now, take them to your police station, talk to your pharmacist, or use one of the drug deactivation kits to get rid of them. We don't want them just sitting around until April. But you can keep that in the back of your mind if between now and then you do need to use them. The next thing I just wanted to mention, we mentioned a workbook, the drug deactivation kits, and we do have these fact sheets that will also be available at the library. We have opioid resources in Wisconsin, so you have a lot of good information there. A review of how prescription opioids and other pain medicines are different. And we have 2 more fact sheets. I believe we do have two more. Oh, how to keep, sorry, she switched it so fast, I didn't even see it. How to keep opioids in a safe location and how to get rid of unused opioids. And then what can go wrong when you use opioid medicines. And with that, that is our presentation for today. Excuse me, I would like to thank the Augusta Memorial Public Library for hosting the program today. And just a reminder, this project is supported by Security Health Plan. So thank you, participants. And if you have any questions for us, we will check before we close out. Stacy was going to be keeping track of any questions. And it looks like she's letting us know no questions came through on the live YouTube. But if you do have questions that come up in the future, or as you're looking at some of the information that you'll be picking up from the library, you can certainly email myself or Shannon, and we will get back to you with appropriate information. And of course, always talk to your doctor or your pharmacist if you have any questions. So thank you. Stacy, anything else you would like to say before we close out the session?
Thank you so much. I appreciate you taking the time to share this valuable information. And we do have some of the drug deactivation disposal kit pouches here at the library, so you can pick those up while supplies last. We also have the workbook and some handouts. Thank you.
Wonderful.